By what age should an infant have doubled its birth weight? A. 9 months. B. 6 months. C. 12 months. D. 3 months. The answer is B. 6 months. An infant should have doubled its birth weight by the age of 6 months, and tripled its birth weight by the age of 12 months. Children who fail to reach these markers may be underweight due to a variety of factors such as underfeeding, metabolic disorder, or failure to thrive. Which of the following is not part of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, Diagnostic Criteria for Autism Spectrum Disorder, ASD? A. Hyper or hyporeactivity to sensory input or unusual interests in sensory aspects of the environment. B. Highly restricted, fixated interests that are abnormal in intensity or focus. C. Hyperactivity impulsivity have been present for at least 6 months to an extent that is disruptive and inappropriate for the person's developmental level. D. Stereotyped or repetitive motor movements, use of objects, or speech. The answer is C. Hyperactivity impulsivity have been present for at least 6 months to an extent that is disruptive and inappropriate for the person's developmental level. All of the behaviors listed are part of the diagnostic criteria for autism spectrum disorder except for disruptive hyperactivity impulsivity present for a period of greater than 6 months, which is part of the DSM-5's diagnostic criteria for attention deficit hyperactivity disorder, ADHD, not for autism spectrum disorder, ASD. A mother brings her 7-year-old daughter into the emergency room after she fell while riding her bike. She was not wearing a helmet and she hit her head on the asphalt. Which of the following is not a sign of late-stage increased intracranial pressure, ICP, in a pediatric patient? A. Dilated scalp veins. B. Bradycardia. C. Diminished level of consciousness. D. Fixed, dilated pupils. The answer is A. Dilated scalp veins. Diminished level of consciousness, bradycardia, and fixed and dilated pupils are all signs of later stage intracranial pressure, ICP. Dilated scalp veins may be present with ICP, but will be seen in the early stages of the condition. A nurse is instructing a parent on proper care for their 7-year-old son who has recently been diagnosed with a seizure disorder. In regards to care during a seizure, the nurse should advise the parent to do all of the following except dash. A. Note the length of the seizure. B. Place a padded tongue blade in the child's mouth. C. Stay with the child for the duration of the episode. D. Move furniture away. The answer is B. Place a padded tongue blade in the child's mouth. A parent of a child with a seizure disorder should be instructed to stay with the child through the duration of the seizure, to move any nearby furniture out of the way of the child to prevent trauma, and to note and record the length of the seizure. No object should ever be put into the mouth of a child who is having a seizure. Which of the following would increase suspicion of strabismus in a pediatric patient? A. The child does not respond to loud or sudden noises. B. Difficulty holding eye contact or responding to social cues. C. The child complains of frequent nausea. D. The child consistently squints or tilts head to see. The answer is D. The child consistently squints or tilts head to see. Strabismus is a misalignment of the eyes that results in one eye becoming dominant over the other. It does not affect hearing or ability to connect to others socially. This condition should not result in nausea. The nurse in the primary care clinic meets with a 22-month-old boy and his mother, who is concerned about his sleeping habits. He cannot sleep without a bottle of milk and wakes during the night to ask for more. What should the nurse tell the child's mother? A. Put juice in the bottle instead of milk. B. It is better for you to leave him with water instead of milk. C. Let him have one bottle of milk at bedtime, but do not give a second bottle. D. He can have a bottle of milk before bedtime, and you can give him another bottle when he asks. E. Do not let him have any bottles in the crib. The answer is B. It is better for you to leave him with water instead of milk. Babies and toddlers should not fall asleep with bottles full of milk or juice with them at bedtime. Plain water would be acceptable for a child to have at bedtime, as it does not have any sugar. The sugar in milk and juice will remain in the child's mouth during sleep and cause caries, even if the teeth are not fully formed. It is common for babies to lose interest in bottles at night time when water is substituted. The nurse cares for a 2-year-old boy whose mother is worried that he is not fully toilet trained yet. The mother is worried because he is not yet able to hold his urine for more than a couple hours, but is proud that he can use the toilet for bowel movements. How should the nurse reply to the mother? A. Your child could be developmentally delayed and should have achieved full toilet training by now. Let me refer you to a pediatric psychologist. B. You should tell your son no every time he wets himself. That is the only way he will learn that his behavior is not acceptable. C. Bladder control is usually achieved before bowel control, but he is on track to become fully potty trained. D. Bladder control is usually achieved after bowel control, but he should be fully potty trained by this age. E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. The answer is E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. Toilet training may be achieved anywhere from 24 months to 36 months, and may sometimes take longer for boys than girls. Bladder control usually occurs after bowel control. Parents should not be concerned if their children take the full 36 months to become toilet trained or if they have difficulty holding their urine longer than a few hours due to the small size of their bladders. Toilet training that takes longer than 3 years may be caused by psychological factors, but this child is not in need of the assessment of a child psychologist at his age. The nurse should not encourage the mother to tell the child that his behavior is unacceptable because it is not expected of him to achieve full toilet training for another year. At what age should an infant show stranger anxiety? A. 2 to 4 months. B. 6 to 8 months. C. 8 to 12 months. D. 4 to 6 months. The answer is C. 8 to 12 months. An infant begins to show signs of anxiety toward strangers between 8 and 12 months of age and may recur until 2 years of age. This anxiety can show as silence, staring, writhing or crying in the presence of people they don't know. At what age does an infant develop the grasping response? A. 3 to 4 months. B. 6 to 8 months. C. 0 to 3 months. D. 4 to 6 months. The answer is C. 0 to 3 months. The grasping reflex is the earliest reflex developed by the infant. It is often present at birth. The infant will grasp at objects such as a finger placed into their open palm. At what age will an infant develop an inferior pincer grasp? A. 6 to 9 months. B. 4 to 5 months. C. 9 to 12 months. D. 2 to 4 months. The answer is A. 6 to 9 months. The inferior pincer grasp is the ability to pick up small objects such as by resting the forearm on a surface and pinching using the sides of the thumb and the index finger. It is an important milestone in the development of fine motor skills. Feelings of sadness, hopelessness, or guilt, insomnia, difficulty coping with normal life activities, social avoidance, and anxiety after giving birth are all signs of what? A. Postpartum psychosis. B. Postpartum anxiety. C. Postpartum depression. D. All of these answers are correct. The answer is C. Postpartum depression. Feelings of sadness, hopelessness, or guilt, insomnia, difficulty coping with normal life activities, social avoidance, and anxiety after giving birth are all signs of postpartum depression, a condition that affects as many as 4 out of 5 people after giving birth. Postpartum psychosis is a much more serious condition, involving delusions, extreme mood swings, and risk of self-harm. What is the cause of postpartum depression? A. An extreme drop in hormone levels. B. Specific vitamin deficiencies. C. Lack of sleep. D. Social stress. The answer is A. An extreme drop in hormone levels. While vitamin deficiencies, lack of sleep, and social stresses can all contribute to depressed mood after giving birth, the primary cause of postpartum depression is an extreme drop in hormones, primarily estrogen and progesterone, that occurs after delivery of the placenta. A first-time mother comes in 10 days after giving birth to a healthy daughter. She is concerned because she has been bleeding continuously from her vagina since labor. The blood is red to brown, and she has been using sanitary napkins, which she must change about every 3 hours. How do you counsel her? A. This is an emergency, refer to urgent care. B. This is normal bleeding as she expels the remains of the content of her uterus after labor. C. This is normal bleeding most likely due to the sudden drop in her progesterone levels. D. This bleeding is abnormal and may be signs of a mild uterine tear. The answer is B. This is normal bleeding as she expels the remains of the content of her uterus after labor. Postpartum bleeding, referred to as lochia, is a normal process wherein the individual sheds blood, mucus, and uterine tissue after delivery. This bleeding can continue for up to 6 weeks, and coloration can change from bright red blood, lochia rubra, to pinkish brown discharge, lochia serosa. A new mother comes in 2 weeks postpartum. She is complaining of left breast tenderness and heat. On Pu, note the slightly enlarged left breast that is mildly erythematous and very tender on palpation. This is most likely what condition? A. Fibrocystic breast disorder. B. Ductal carcinoma. C. Mastitis. D. Benign cyst. The answer is C. Mastitis. Mastitis is an inflammation of the breast tissue, often due to milk stasis in a breastfeeding individual and occurring most commonly in the first few weeks after delivery. Causes can include poor latching, tight bras or clothing, or infection. Incidence is higher in individuals who are immunocompromised, and in people with cracked nipples or past history of mastitis with a previous birth. Mastitis is not an emergency, nor is it any type of cancer, cyst, or serious breast disease. How long would the umbilical cord stump generally remain on a newborn? A. 4 weeks. B. 1 week. C. 2 to 3 weeks. D. 2 to 5 days. The answer is C. 2 to 3 weeks. The stump of the umbilical cord will generally remain for 2 to 3 weeks after delivery. During that time the stump's coloration will change from blue to black as it dries. Eventually it will fall off much like a healing scab, leaving behind the umbilicus, navel. The nurse cares for a 2-year-old boy whose mother is worried that he is not fully toilet trained yet. The mother is worried because he is not yet able to hold his urine for more than a couple hours, but is proud that he can use the toilet for bowel movements. How should the nurse reply to the mother? A. Your child could be developmentally delayed and should have achieved full toilet training by now. Let me refer you to a pediatric psychologist. B. You should tell your son no every time he wets himself. That is the only way he will learn that his behavior is not acceptable. C. Bladder control is usually achieved before bowel control, but he is on track to become fully potty trained. D. Bladder control is usually achieved after bowel control, but he should be fully potty trained by this age. E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. The answer is E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. Toilet training may be achieved anywhere from 24 months to 36 months, and may sometimes take longer for boys than girls. Bladder control usually occurs after bowel control. Parents should not be concerned if their children take the full 36 months to become toilet trained or if they have difficulty holding their urine longer than a few hours due to the small size of their bladders. Toilet training that takes longer than 3 years may be caused by psychological factors, but this child is not in need of the assessment of a child psychologist at his age. The nurse should not encourage the mother to tell the child that his behavior is unacceptable because it is not expected of him to achieve full toilet training for another year. What is a normal hematocrit for a newborn? A. 45 to 65%. B. 60 to 80%. C. 35 to 40%. D. 50 to 75%. The answer is A. 45 to 65%. Normal hematocrit in a newborn is 45 to 65%. This is measured via heel stick just after delivery. This test is useful in assessing for anemia, suggested by a low hematocrit, and polycythemia, suggested by a hematocrit over 65%. Which of the following should be encouraged in a person presenting with mastitis? A. Go to urgent care if a high fever develops. B. Wear a loose-fitting bra. C. Breastfeed as much as possible. D. All of these are correct. The answer is D. All of these are correct. The most common treatment for mastitis is frequent breastfeeding, along with rest and loosening of any tight-fitting clothing. Most cases of mastitis are non-infectious and do not require antibiotics. However, high fever can be a sign of infectious mastitis, and may require pharmaceutical intervention. At what age does an infant learn object permanence? A. 6 to 8 months. B. 2 to 4 months. C. 3 to 5 months. D. 5 to 6 months. The answer is D. 5 to 6 months. Object permanence is the understanding that an object still exists even when it cannot be seen, heard, or touched. It is often tested by placing an object on a surface, then covering that object and allowing the infant to attempt to uncover it, thus demonstrating a knowledge that the object remains present though it is hidden. Which of the following is not a part of the Apgar score? A. Appearance. B. Respiration. C. Activity. D. Gurgling. The answer is D. Gurgling. The Apgar score is a test of newborn health and physical function, designed to assess a newborn for need of emergency assistance. The factors used to calculate the score are the following: appearance, pulse, grimace response, activity, respiration. Which of the following behaviors would be under the category grimace in the Apgar score? A. Coughing. B. Pulling away. C. Sneezing. D. All of these. The answer is D. All of these. The grimace category of the Apgar score actually refers to a wide variety of reflexive behavior. These include sneezing and coughing, crying on stimulation, pulling away, and facial expression. At what time after birth is the Apgar score calculated? A. At 1 minute only. B. At 1, 5, and 10 minutes. C. At 1 and 5 minutes. D. At 5 minutes only. The answer is C. At 1 and 5 minutes. The Apgar score is calculated 1 minute after birth, and then again at 5 minutes after birth. It is common for infants to be born with depressed respiration, cyanosis, and other physical signs of struggle that are quickly resolved within 5 minutes after birth. If signs of respiratory or cardiovascular distress do not improve by this time, however, emergency intervention may be required. You have just calculated a newborn's 5-minute Apgar score as 5. What is the proper response? A. Do nothing, this is a normal score. B. Emergency intervention, this is a severely depressed score. C. Do nothing, this is a perfect score. D. Monitor closely, this is a moderately depressed score. The answer is D. Monitor closely, this is a moderately depressed score. The Apgar scale goes from 0 to 10. A score of 0 to 3 would indicate severe depression of function, 4 to 6 would indicate moderate depression, and 7 to 10 would be a normal, healthy score. In the case of moderate depression, the newborn should be monitored closely. Immediate emergency intervention may not be required, as healthy neonates can have moderately low Apgar score indicators that improve in the first few hours of life. What is a normal heart rate for a newborn 2 hours postpartum? A. 110 to 160 beats per minute. B. 60 to 90 beats per minute. C. 140 to 190 beats per minute. D. 80 to 110 beats per minute. The answer is A. 110 to 160 beats per minute. A newborn's heart rate is significantly higher than that of an adult. Normal heart rate for a newborn 2 hours postpartum is 110 to 160 beats per minute. Heart rate decreases in the first year of life to 80-140 beats per minute. A nurse assists in the delivery of a healthy 7 pounds, 4 ounces infant. 6 days later the parents call the clinic with some concern. They state that their daughter has begun to lose weight. She has lost nearly 10 ounces since birth, despite breastfeeding regularly. How should the nurse counsel this couple? A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. B. This is an emergency. The couple should bring their infant to the emergency department. C. This is not normal but not yet a cause for concern. D. This is abnormal and cause for serious concern. The answer is A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. It is normal for infants to lose 5 to 10% of their birth weight in the first 7 days of their lives. In a healthy baby, this weight will be regained by the end of their second week. Infants who are born ill or premature may take longer to regain this weight. If an infant has passed the second week of life and it has not returned to or surpassed its birth weight, the family may need to seek lactation counseling or bring the infant in for further evaluation. Which of the following is a test for hip dysplasia in an infant? A. Faber test. B. Thomas test. C. Ortolini test. D. Ober test. The answer is C. Ortolini test. An examiner can look for hip dysplasia in an infant using the Ortolini test. This is performed by placing the child supine, then flexing the hip and knee to 90 degrees. They would then gently abduct the leg while placing downward pressure on the greater trochanter. In a healthy joint, the hip will move freely. In hip dysplasia, there will be a feeling of a clunk as the femoral head is relocated into the acetabulum. The Ober test, Thomas test, and Faber test all check for hip stability and injury in adult populations, rather than pediatric. A new mother is holding her infant just moments after delivery. After she is able to rest for a short time, she looks down and notices that her newborn is covered in fine, but fairly dark hair. This is on the infant's arms, legs, and back. She is startled and asks the nurse if this is a sign of any disorder. How should the nurse reply? A. This is abnormal. A hormone profile is required to rule out hormonal disorder. B. This is normal. It should be shed in a few days. C. This is a sign of a serious metabolic disorder. D. This may be normal. The child should be monitored. The answer is B. This is normal. It should be shed in a few days. Fine, downy hair, called lanigo, generally appears on the fetus around 5 months of gestation. It is often shed before birth, but some infants are born with this hair still intact. The hair is normally shed within the first 1 to 3 weeks of life. In most cases it is entirely normal and not a sign of hormone or metabolic disorder. A young couple presents to a clinic with a 7-year-old who has varicella, chicken pox. The child is not in any distress and the virus seems to be progressing normally. They are concerned, However, because one of them is currently pregnant with their second child, they are at 31 weeks of gestation. The carrying mother had chickenpox when she was 2 years old. They asked the nurse if they should be concerned for the health of the unborn child. Which of the following is the most appropriate response? A. There is no need for concern. B. Frequent hand washing is recommended to prevent passing of the viral load to the fetus. C. The mother should not be in contact with the 7-year-old till the last lesion is scabbed over. D. There is mild need for concern, fetal monitoring is recommended. The answer is A. There is no need for concern. As long as the carrying mother has had varicella, she will be able to pass the antibodies to the virus through the placenta to the unborn child. This will confer passive immunity to the fetus. This immunity lasts for the first few months after birth, so newborns delivered by mothers with immunity to varicella will remain immune for some time even after delivery. Increased immunity to this and other pathogens is conferred by breast milk, which contains maternal antibodies, mostly IgG. By 5 months of age, what change would be expected in an infant's weight? A. Triple. B. Increase by at least 70%. C. Increase by at least 50%. D. Double. The answer is D. Double. An infant would be expected to double its birth weight by 5 months. Some infants may double their birth weight by 3 to 4 months. An infant that has surpassed 5 months without approaching twice their birth weight may need to be evaluated for feeding difficulties or failure to thrive. At what time does molding, the elongation of the baby's head as it passes through the birth canal, resolve in a newborn? A. Less than 24 hours. B. 2 to 3 weeks. C. 10 to 14 days. D. 1 to 5 days. The answer is D. 1 to 5 days. Molding, or the elongation of the infant's head during labor and delivery, is a normal adaptation allowing the relatively large skull to traverse the narrow space of the birth canal. It generally resolves in 1 to 5 days. How long after birth should a newborn pass meconium? A. 2 to 6 hours. B. 24 hours. C. 3 to 5 days. D. 2 weeks. The answer is B. 24 hours. Meconium is a sticky, dark green to black stool that is the first stool passed by neonates after birth. It is composed of the content of the infant's digestive tract before it has begun drinking milk, primarily water, mucus, bile, lanigo, and intestinal epithelial cells. A newborn that has begun to feed on breast milk or formula should pass a normal stool, yellow to mustard green and creamy rather than sticky, within 24 hours. The nurse counsels the mother of a 2-month-old infant. Which of the following actions by the mother would be inappropriate? A. The mother makes eye contact when she speaks to the baby. B. The mother places the infant on her back during naps and at bedtime. C. The mother swaddles the child in blankets for naps. D. The mother waits 6 months before introducing infant cereals to the baby's diet. E. The mother lets her cry for 5 minutes before responding if the baby cries at night. The answer is E. The mother lets her cry for 5 minutes before responding if the baby cries at night. Infants younger than 6 months may have trouble sleeping for long periods of time because they awaken from hunger. Their stomachs are not yet large enough to hold enough nourishment to keep them asleep during the night. After 6 months, it is more appropriate to let babies cry themselves and put themselves to sleep, but before 6 months, it is not recommended. The other actions are appropriate. Infants should sleep on their backs to prevent sudden infant death syndrome, SIDS. Babies should be interacted with frequently. Breast milk is recommended exclusively for the first 6 months, and swaddling the child is important because the infant cannot sleep in loose blankets. The nurse performs triage in the emergency department for a patient with a bee sting. The family reports a history of allergic reactions to bee stings, and the patient complains of difficulty breathing and swelling in his mouth. Which of the following is the priority of the nurse? A. Contact the physician. B. Administer subcutaneous epinephrine. C. Obtain a full patient history. D. Maintain an open airway. E. Administer oral diphenhydramine. The answer is D. Maintain an open airway. Follow the ABCs of nursing priority: airway, breathing, circulation. It is most important for the nurse to maintain a patent airway, as the symptoms manifested suggest an anaphylactic reaction. Epinephrine may be given after the airway is established. Oral diphenhydramine is usually given for mild allergic reactions. The physician may be contacted later. Patient safety is the priority. The nurse is discussing end-of-life care procedures with an elderly patient who is Buddhist. The nurse knows that the patient will most likely want to incorporate A. No blood transfusions. B. No autopsy and cremation. C. Prayers to provide support and comfort. D. Time for meditation. The answer is D. Time for meditation. Buddhists will want time for meditation, and may refuse medications that alter awareness. A shrine to Buddha may be placed in the client's room. The nurse cares for an 82-year-old woman with frequent constipation. Which of the following statements by the nurse would be inappropriate? A. It could help to remove dairy products like milk and cheese from your diet. B. Make sure you are well hydrated. 6-8 glasses of water a day would be good. C. You should eat dark green vegetables and whole grains. D. You can take a laxative whenever you want to have a bowel movement. E. You can try light exercise for at least 30 minutes every day. The answer is D. You can take a laxative whenever you want to have a bowel movement. Elderly patients may suffer from bowel problems like constipation due to lower motility in the gastrointestinal tract. The nurse should advise this client to exercise daily, to increase blood flow to the GI tract, stay hydrated, to prevent hard, dry stools, eat more fiber, such as fruits, vegetables, nuts, grains, and beans, and stay away from milk and cheese, as lactose sensitivity is common and may be a cause of constipation or bloating. This patient should not take laxatives each time a bowel movement is expected. Reliance on laxatives is not recommended because it can desensitize the bowel and make constipation worse. An emergency room nurse is assessing a 26-year-old female patient who frequently uses opium. What symptoms would indicate that she is experiencing withdrawal? A. Diaphoresis, seizures, and apathy. B. Irritability, tremors, and seizures. C. Nausea, vomiting, and anxiety. D. Fatigue, disorientation, and craving. The answer is C. Nausea, vomiting, and anxiety. Anxiety, nausea, and vomiting are common symptoms of opium withdrawal. A nurse is monitoring an 18-year-old who is experiencing heroin withdrawal. What symptoms might the nurse observe? A. Seizures, tremors, and tachycardia. B. Nausea and fainting. C. Yawning, cramps, and diarrhea. D. Coma and convulsions. The answer is C. Yawning, cramps, and diarrhea. Yawning, cramps, and diarrhea are common signs of heroin withdrawal. Which of the following drugs is considered a central nervous system, CNS, depressant? A. Marijuana. B. Nalol. C. Cyclobenzaprine. D. All of these. The answer is D. All of these. All of the drugs listed are considered to be CNS depressants. While generally classified as a psychedelic, marijuana has multiple central depressant effects such as sedation and muscle relaxation. Also, alcohol is another commonly used depressant. Alcohol abuse-induced thiamine deficiency can cause which of the following? A. Wolff-Hirschhorn syndrome. B. Lewy body dementia. C. Agnosia. D. Wernicke-Korsakoff syndrome. The answer is D. Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is caused by a severe deficiency in thiamine, often seen in severe alcohol dependency. It is characterized by visual disturbances, ataxia, and altered consciousness. Wolff-Hirschhorn syndrome is a genetic disorder causing developmental disability and may involve seizures. Lewy body dementia is associated with Parkinson's disease. Agnosia is a neurological disorder causing impaired ability to process sensory information. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, criteria for substance abuse includes all of the following except A. Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. B. Recurrent substance use in situations in which it is physically hazardous. C. All of these are part of the DSM-5 criteria for substance abuse. D. Continued substance use despite having persistent or recurrent social or interpersonal problems caused by or exacerbated by the effects of the substance. The answer is C. All of these are part of the DSM-5 criteria for substance abuse. All of the items listed are part of the DSM-5 criteria for substance abuse. In addition, the individual's symptoms must not qualify for substance dependence, and recurrent substance-related legal problems are other DSM-5 criteria for substance abuse. A 42-year-old man presents to the ER for alcohol toxicity. While taking the history, the nurse discovers that he drinks on average 1/5 of vodka per night, and often must drink an additional 6 to 12 ounces to get a good buzz. When he doesn't drink, he experiences tremors and feels unwell until he is able to drink again. When asked if he would like to quit drinking, he states that he has tried unsuccessfully several times over his life. He knows that he needs to get control over his drinking because it is seriously impairing his relationship with his husband and their 13-year-old daughter. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, this patient can be considered to have which of the following conditions? A. Substance dependency. B. Substance addiction. C. substance abuse. D. None of these. The answer is A. Substance dependency. The symptoms described by this patient put his alcohol use in the category of substance dependency, according to the DSM-5, a more severe form of abuse than substance addiction. The criteria for this condition are: tolerance, withdrawal, unintentional excesses in consumption, persistent desire or unsuccessful efforts to reduce or control substance use. A great deal of time is spent to get, use, or recover from the substance. Interference with social life. The substance use is continued despite knowledge problems caused by use. Prolonged alcohol abuse can result in a severe deficiency in what vitamin? A. Vitamin C. B. Thiamine, B1. C. Niacin, B3. D. Folate. The answer is B. Thiamine, B1. Prolonged alcohol abuse can result in a severe deficiency in thiamine, or vitamin B1 by reducing dietary thiamine intake, impairing gastrointestinal absorption of thiamine, and causing impaired thiamine utilization in cells. Note that individuals who partake in prolonged alcohol abuse may have various other dietary deficiencies. Prolonged alcohol abuse can result in a severe deficiency in what vitamin? A. Vitamin C. B. Thiamine, B1. C. Niacin, B3. D. Folate. The answer is A. Delirium tremens. Delirium tremens, DT, is a rapid onset of confusion seen during alcohol withdrawal. The symptoms of DT include altered mental status, autonomic instability, and even seizures. DT is also characterized by hallucinations such as the sensation of something crawling on the patient. DT is the most severe consequence of withdrawal and can be fatal if untreated. The client in the termination phase of the nurse-client relationship is being very confrontational. How should the nurse interpret this behavior? A. The patient should be admitted to the hospital. B. This behavior is common for a client in the termination phase. C. The nurse has done something to offend the client. D. The treatment should revisit the working phase. The answer is B. This behavior is common for a client in the termination phase. Confrontational behavior is very common for a client in the termination phase. The nurse should not assume that she offended the client, and further action in terms of therapy should not be addressed until completing the termination phase. The nurse is in the orientation phase of the nurse-client relationship where the client has been sexually assaulted. During this phase, the nurse should A. Explore personal ideas, stereotypes, and biases that might affect the nurse-client relationship. B. Identify themes of patterns of patient behavior and possible coping mechanisms. C. Establish acceptance, trust, and boundaries. D. Actively listen to the client express his thoughts and feelings. The answer is C. Establish acceptance, trust, and boundaries. During the orientation phase, the nurse should establish acceptance, trust, and boundaries with the client, which will be built upon in later phases. Acceptance, trust, and boundaries are established during which phase of the therapeutic nurse-client relationship? A. Orientation. B. Working. C. Pre-interaction. D. Termination. The answer is A. Orientation. Acceptance, trust, and boundaries are established in the orientation phase of therapy. Identify the disorder that presents the following signs and symptoms: numbness, paralysis, loss of vision, or other neurological symptoms after a traumatic or stressful event, without any identifiable medical cause. A. Conversion disorder. B. Bipolar disorder. C. Schizophrenia. D. Stiff person syndrome. The answer is A. Conversion disorder. Conversion disorder is typified by numbness, paralysis, loss of vision, or other neurological symptoms after a traumatic or stressful event, without any identifiable medical cause. Schizophrenia, bipolar disorder, and stiff person syndrome all have medically identifiable causes. What is the best approach towards dealing with a delirious patient? A. Frequent sedation with antipsychotics. B. Frequent sedation with benzodiazepines. C. Frequent reorientation to time, place, and name. D. Frequent 4-point restraints. The answer is A. Frequent reorientation to time, place, and name. Delirium is an organic dysfunction of the brain usually seen in sick patients post-op. These patients need frequent reorientation to name, time, and place until the delirium resolves. Agitation, confusion, and difficult to control behavior is typically controlled with antipsychotics, however, they are not first-line treatment. Restraints should be avoided at all costs. Which of the following describes the professional role of the nurse in a healthcare setting? A. Caregiver. B. Patient advocate. C. Assessment. D. All of these. The answer is D. All of these. All of these are important professional roles of the nurse in a healthcare setting. You are a new nurse taking care of a patient with congestive heart failure. You see an order to administer 500 milliliters of 0.9% normal saline over 6 hours. Later on in your shift, you realize that you mistakenly administered 2000 milliliters of 0.9% normal saline over 2 hours, and now the patient is slightly short of breath. Which of the following is the most appropriate next step? A. Do not tell anyone of the error since the patient is stable. B. Immediately inform the covering physician. C. Immediately contact your hospital's safety oversight committee. D. Immediately administer furosemide to diurese the patient. E. Ask your co-nurses whether or not to inform the covering physician. The answer is B. Immediately inform the covering physician. In this case, a medical error was committed, and the most appropriate immediate course of action is to let the patient's covering physician know, so that they can determine what effect this may have on the patient, assess the patient, and determine what, if any, immediate intervention needs to be performed to ensure that the adverse effect on the patient is minimized. While it is possible in this case, given that the patient has congestive heart failure, and that they may have been fluid overloaded by the administration of excess fluids, that they will need to be diuresed with furosemide, this medication cannot be administered without the order of the covering physician, and it would be inappropriate to administer furosemide without their orders. While your hospital's Safety Oversight Committee may ultimately need to be informed of this incident, the most immediate priority is patient safety, and as such, the patient's physician should be notified of the medical error before anyone else so that they can best manage any immediate consequences of the error. It would be highly inappropriate to not inform anyone of the error, as an unintended dose of 4 fluids was administered, and this can be dangerous in a patient with congestive heart failure. Any delay, whether due to not telling anyone, or to conferring with co-nurses, in informing the supervising physician would be inappropriate and potentially dangerous to the patient.